Okay, great. All right, I see some folks trickling in. So welcome everybody. We will get started promptly at 1 o'clock. And just for cross-check, Deb, you can still see my slide? Okay, great. Thank you. Hey, welcome everybody. I see we have 39 attendees. Thank you for being prompt. We have about 3 minutes and counting until we kick off our inaugural patient experience talk. So hang in there. Thank you for joining today. Should you have any questions or challenges, feel free to put it into the chat here. And it looks like, okay, it lights up. Oh, great. Thanks, Deb. So good to know. It like, there's a good visual cue when there is a chat. Okay, in the last minute before we get started, should you have any questions or comments or technology challenges, feel free to put it into the chat box. We have a group of folks that will be monitoring the chat throughout the next hour, and we will get started very soon. All right, so we're gonna go ahead and kick off. This is our inaugural PX talk, so comprised of 4 panelists that will be sharing their expertise in terms of, making healthcare kinder, safer, and more reliable. Before we get started, everybody should be on mute. Should you have any questions, feel free to utilize the chat. We have a group of people that will be monitoring that throughout the next hour. First, I wanted to introduce you, and this would not be happening today without Scott Fidel. So Scott is on our RWJBarnabas Health team. He's the audio-visual manager under corporate telecom, and he's been doing this for over 10 years and just helping me set it up. We spent hours on the phone making sure this runs as smoothly as possible. As a reminder, this session is being recorded, so folks can see the presentation afterwards as well. Okay, let's see. Deb, you said my slide is too big on the screen?
Yeah, it looks a little big for me. Scott, looks cut off.
Is it cut off on your screen too, Scott?
No, seeing everything.
Okay.
Deb, there's a zoom. You might be zoomed in. If you scroll on it, it'll zoom out a little bit for you. And that goes for anybody else as well.
Okay, great. Good to call that stuff out now in the beginning. Also, for your reference in the handout section, there are a couple handouts, including the slides that will be presented today for your reference thereafter. So I had experience in doing being a curator for TEDx Marsville a few years ago, which inspired this vision of mine to do something similar. And no one greater than Deb Larkin-Carney to be the curator for this event today. Deb is responsible for so much across our RWJBarnabas health system. She oversees quality, she oversees all the tasks associated with that, as well as safety, our safety journey, as well as patient experience now. And just amazing to work alongside of her. I've learned so much reporting to her for the last year and a half. And, 40 years of experience in healthcare speaks volumes. So she'll be curating today's events. And I'm going to pass it off to her, she will then talk about the agenda for today and then start introducing each of the speakers as we get ready for our speeches. So Deb.
Thank you so much, Jill. I really appreciate the opportunity to be part of this great inaugural approach for us to celebrate our Patient Experience Week, but even more in comprehending everything. We really made making healthcare kinder, safer, and more reliable has our theme for both Patient Safety Week, which was several weeks ago, and Patient Experience Week, because it really is that same theme and message. It really speaks to our culture, the culture that we have and the culture that we are continually trying to develop and really make it so robust. It embodies our high reliability principles. It is actually the integration of our work, and the culture is so very important. Why that? So while you are listening today, I really want you to start thinking and maybe challenging yourself on what is patient experience and how does the journey, the culture really impacts what we have as patient experience. And it's not only about patient experience, is it? It's also how we treat each other, how we as employees and as individuals treat each other. And I think we have such a great diversity of speakers with different backgrounds that will be able to tell you about their journey, about developing culture, how kinder, safer, more reliable frames their work and what the work that they are doing. So I'm really hoping that you really listen to the speakers about that kinder, safer, more reliable and what it means to them in their work, and also start thinking about how does it fit into your work and also our work as a system, and how that culture really is tantamount for us to have great patient experience. I'm so excited to have the speakers we have here today. They each will have a great message that you then will see how it all integrates everything together. So you have here your agenda, and it talks about the 4 speakers that we have for you today. And so I'm really excited to kick it off with Jill Anderson. Jill is our System Vice President of Patient Experience. But I will tell you that it really is more than that. Jill really brings in her passion, but also a very rigorous PI structure to patient experience. She does that through her experience of Lean Six Sigma. We're lucky to have her as a Master Black Belt. Also project manager, professional, as well as being an MBA. But I think what's the most interesting thing about Jill, she actually spent 3 years in the Peace Corps about Samoa, and she's actually fluent in Samoan language. But she has a great vast experiences which she brings in to us as we go forward thinking about patient experience and engagement, and also how it truly is affects all of us as our work with each other and with our patients with that. So without any further ado, I will turn it over to Jill.
Thank you so much, Deb. Sound check, you can hear me, correct?
I can, yes.
Okay, wonderful. Thank you. So 12/45/2020. No, I'm not calling a sports play or playing bingo. Rather, it was 12 of our sites where I interviewed over 45 patient and family advisory council members back in 2020 when I stepped into this role as System Vice President of Patient Experience at RWJBarnabas Health. So for those who may not know, Patient and Family Advisory Council is a group of current and or former patients or their companions who collaborate with us on many ways that we can make improvements regarding patient experience as well as quality of care. So as I reflected about, what does it mean to make healthcare kinder, safer, more reliable, I was brought back to those interviews in 2020. In our high reliability organizing journey, we know that our patients want us to help them, not to harm them, and to be nice to them. So as a learning organization, I wanted to learn from our PFAC members and really ascertain what the heck does patient experience even mean to them, and really honing in on that be nice to me portion of our high reliability journey. Meaning, what does it look like? What does it sound like? And what does it feel like for them as well? So here is an infographic, collage per se, capturing some of the themes that I heard them say during these interviews. You see respect, dignity, a culture driven by relationships and love. So here is one of the sentiments I would like to share with you from that interview. People need to feel good. Lots of feelings you see on this screen, right? So simple acts of kindness help families. It's basic stuff. It's the small gestures that make a difference, especially when there are system breakdowns, like when we have to wait. Keep us informed. Their feedback really helped to carve out this patient experience promise that you see at the bottom of the screen, which is how we deliver on the patient promise of providing safe, high quality care in a compassionate, patient-centered environment. So we do this by having a very strong foundation of engaged and resilient care teams across the entire continuum of care. So it became apparent as I studied the interviews and did my own thematic analysis that connect, inform, and respect were the most commonly used words from our patients and families, especially after hearing Chris's story about his daughter, Caitlin. On Thanksgiving Eve, 2008, while walking home from Rutgers, his eldest daughter, Caitlin, was struck and hit by a drunk driver as she walked home from a Rutgers pep rally after a Thanksgiving Day football game. As a parent, I can imagine the angst that he went through, and Caitlin spent 8 months as an inpatient and 7 years as an outpatient at Children's Specialized Hospital. Shortly after the accident, Christian was invited to join the Patient and Family Advisory Council at Children's Specialized. So as I was speaking with him, and we spoke hours actually, he really believes that we are all connected. The patient, the doctors, the nurses, the aides, housekeepers, the therapists, administrators. I think he named everybody that works for us. We're a team connected by the overwhelming desire to give the absolute best care to the patient. We're a team that cannot win without every single team member giving all for the patient in order to keep them informed regarding their care in the most respectful way possible. So in this patient-centered environment, we need to make sure that we're connecting, informing, and respecting our patients, their companions, and even each other as staff members. The PFAC members gave me a few examples of what being nice to me sounds like. So I wrote some down here. From a connection perspective, it's always making that compassionate connection, informing, making sure we are always listening and explaining when they have questions, and the respect piece, making sure that we're always using our 5 tones, as well as aided, acknowledging, introducing, duration, explaining, and thanking our patients as well. So from a safer perspective, it's making sure that this was the hard part for me, right? I'm non-clinical. So how does being nice and kind really impact that safety piece? So I took to reading Compassionomics, and there's a link with his Steve Treziak and Anthony Mazzarelli from Cooper Health wrote the book, the CMO and CEO there. So the TEDx is in the documents. And what Steve and Anthony said was that it highlighted that it's a revolutionary scientific evidence that caring makes a difference. And he noted the following: compassion has physiological effects on patients, like modulating patients' perception of pain, improving blood sugar control, and enhancing immune system function. Compassionate care makes patients more comfortable when they are in pain, feeling ill, or suffering from mental or even emotional stress. Kindness can actually decrease blood pressure and cortisol, which directly impact stress levels as well. So that's how making healthcare kinder, safer, and now the more reliable piece. What exactly does that mean? So the definition of reliability is the quality of being trustworthy. Trust is so important in healthcare on so many levels, and making sure that we're performing consistently well always. So when we're able to align our being nice behaviors always and keeping respect for people at the center of what we do, guess what happens? There's numerous financial benefits that are then the output of that. So for example, according to an article in Harvard Business Review in 2018, we know that for every 5-point increase in a hospital's rating, there's a 1% increase in profit margin. So it literally pays for us to be nice. So during my interviews with these PFAC members, I also decided to do not only a patient journey map, but a doctor journey map, a nurse journey map as well. And literally we sat there with emojis. And, this is just an example of how emotional the journey is, not only for our patients, but for their companions and our workforce as well. So this array of different emotions can be exhausting. And the word patient actually has Latin roots. Pati actually means suffering. So, so many people are suffering. And after 2 years of being in this pandemic, we're really suffering in healthcare. So what can we do in healthcare then to make it kinder, safer, more reliable, knowing that kindness actually helps to, decrease that pain? Engaging in acts of kindness actually produces endorphins, which are the brain's natural painkiller. It also reduces stress. Perpetually kind people actually have 23% less cortisol, that stress hormone I previously mentioned, and they actually age slower than the average population. Being kinder also reduces anxiety. As a matter of fact, according to a University of British Columbia study, a group of highly anxious individuals performed at least 6 acts of kindness a week, and after 1 month, there was a significant increase in positive moods, and better relationships were noted as well. So I'm going to end it with this. My challenge to everyone today, not only today, but every day, is to be nice to at least one person. So, feel free to share if you have an example of how you were already nice to somebody today, or other ideas. Feel free to put in the chat. And as I mentioned, there's a couple of handouts as well that you will find in the portal. So happy to answer any further questions that you may have in the chat. And at this point, I'll pass it back over to Deb.
Thank you, Jill. I have not seen anything in the chat at this point in time. I do want to point out on your right-hand side that says has handouts too. Those where you can download your 2 handouts. But I think what we really, what really stuck with me, and I like for everyone to consider this, is those words that she put up there for you. What does it mean to you? How do you and your patients and your coworkers experience these words? What does it mean? We have to think of when we're taking care of others, what does it mean to them as well? I love the team. It's a team connected to care. And of course, that scientific evidence, that is breaking news, I think, for many of us, that compassion and kindness can actually make differences in the physiological status of our patients. So really appreciate that, and that call to action is a good idea. So there's your references. All right. So now, next up, we have Mr. Alan Lee. He is the Senior Vice President and Chief Operating Officer at the Robert Wood Johnson University Hospital. And one of the things I have to tell you, working with Alan Lee since his arrival to the University Hospital, is what I see is his really driving excellence in patient care in all areas. Truly looking at quality, performance, and patient experience is absolute a must for Alan. You'll hear that when you listen to him talking today. He has extensive experience in hospitals, as you can see right there. But additionally, what I think it makes it interesting, his early background was in hospitality management, and how does that impact of how he sees experiences people have in various things. And of course, people always talk about, well, the hospitality world is different than hospitals, but we have learned from many different folks that we can learn from other industries. And I think this is one of the power that Alan Lee brings to us. And I'm very excited for you to hear Alan and his thoughts on kinder, safer, and more reliable healthcare. So Alan, I turn it over to you.
Deb, thank you very much for that kind introduction. Jill, also thank you for those words, encouraging and inspirational as they are. I extend a happy patient experience week to all of our healthcare heroes. That's a term that we were all hearing during the last 2 years, and I think, quite frankly, it's an extraordinarily fitting term. These last 2 years have tested us in extraordinary ways. Our healthcare workforce has demonstrated teamwork, empathy, compassion, and resilience. But in the darkest hours, we had to close our doors to visitors, and our team members became family for our patients in their most vulnerable moments. I would have you reflect back on some of the time that we're describing here. Each of us are here in what I call on purpose. Each of us are here with a purpose. What is it that calls you to this work? What is it that calls each of us to this work? Because each of us has a story, each of us has a reason for being here. The COVID-19 pandemic continues to teach us many lessons, and for me, one of those is the reminder of gratitude. Each day, quite frankly, is actually a gift. Each day is a new opportunity, and we each should consider what is our purpose for the day. I try to intentionally consider as I awaken each morning, rather than just the thought that I'd like to have 5 more minutes and so I'll snooze the clock of rest, but begin to contemplate, what's my purpose for today? How do I have an opportunity to touch the life of someone else and improve their experience in the time that I'm afforded today? Because today, in this moment, really is all that we have. We have to consider, how do I live out my purpose, my core values, and at the same time enliven the Robert Wood Johnson Barnabas Health Values vision, and mission. As you heard from Jill earlier, and as you heard from Deb, this year our theme is making healthcare kinder, safer, and more reliable. In my opinion, that fits really nicely as we consider our HRO journey. We should be encouraged to extend random acts of kindness to our patients and visitors. But what makes for the actual patient experience? And I am a firm believer that all of us impact the patient experience. All of us are part of the patient experience. It begins long before they arrive. The patient experience, we have to consider, what does the scheduling process look like for our patients? Is it easy? Do we answer phones in anticipation and with kindness? What does the arrival experience look like? Do we anticipate the arrival of our patients and any of their family members or guests that are accompanying them? Do we warmly greet them? Do we seem to have expected their arrival? Think about the complexity of our different environments. Sometimes wayfinding can be a real challenge for people that are not working here every day. And as someone who joined the organization relatively recently, wayfinding can be a challenge even for those of us who work here. We have things as small as overcrowding in the elevators, particularly in a pandemic and a post-pandemic world almost. Our patients are wondering, should I get on this elevator that already has 4 of the workforce team members on it? Parking, I could go on and on and on. There are so many small elements that impact. But I think largely what our patients will remember is how we interact with them, how we interact with their visitors, and frankly, how we interact with each other. Is there professionalism in those interactions? And is there kindness? Is there compassion? As we think about all of those are some of the elements of how we extend kindness. As we think about that second piece, though, safer, safety to me is about the pause. It's about the thoughtfulness and about the planning. Before we move forward with the procedure, before we move forward with this interaction, let's pause and be thoughtful about how to best frame it, what is the best planning, and the safest way to proceed. And when I think about more reliable, that frankly to me is about consistency. I actually have grown to appreciate, and I say that thoughtfully, I've grown to appreciate this HCAP's top box answer for most of our domains, which is always. Always is really calling us to be more reliable in our delivery, and do patients really anticipate that those service deliveries, those care deliveries will be done in a consistent fashion that is always occurring, which means that it's much more reliable. When we think about the work that we have, as I said earlier, this is really a calling. It's an opportunity. Each and every day, each moment, quite frankly, we have the opportunity to change who we are, quite frankly, and how we anticipate the world. I love the thought and the phrase, to be the change that we wish to see in the world. And what that really reminds me of is, rather than waiting for a government to change us, or waiting for systems to change, or waiting for our families or our relatives or our friends to change, change begins always with the person in the mirror. It begins first with self. I would have us consider that there is an opportunity that we're each given when patients entrust their care to us to really pause and be grateful for that. Sometimes we have challenging situations, and sometimes we might consider describing a patient as difficult. But I would suggest that there is no such thing as a truly difficult patient. There is such thing as human beings in their vulnerable moments having difficult times. I easily can go back to the thought that many of us will be reminded of the danger of trying to help a lion that may have a thorn in its paw. Or frankly, a little bit more domestically, if you have pets in your household, if you have an injured or wounded or sick puppy or kitten, sometimes trying to help them, they're not going to be on their best behavior often, and you risk being sort of bitten by them. But I'm also reminded in our humanity, those same behaviors occur. For those of you out there who are parents, who are blessed to have been on that journey, you know that caring for a child who's not feeling at his or her best, they are going to display that in their behavior. And most of us become adults with that child that lives within, that when we are not well, we're typically not at our best. It gives us the opportunity to demonstrate true compassion, true patience, to listen, to respond thoughtfully and kindly, and to put the best foot forward in terms of how we care for our patients every single day. These stories that we have of our patients can go any direction, and we get to choose. We get to actually tell what the narrative will be in terms of our patient experience. And although it's largely publicly reportable now, we get to really decide what that narrative becomes for us. I would have us to pause to think, if I was the patient, or if my loved one, my mother, my father, my sister, my brother, my husband, my wife, my son, my daughter, were the patient, how would I want that care delivered? We know that you all have incredibly busy days each day. And yet it's about taking the time to do the most meaningful work that we are afforded every single day. I will close by simply thanking you for choosing to respond to this calling. It's extraordinary. And whether you are someone who serves meals to the patients or keeps the patients safe by cleaning their room, or providing clinical care in any of the many clinical disciplines, or you are really sort of what we would refer to as behind the scenes in areas such as finance or systems, IT, etc., all of the work that we do is meaningful, and we could not do what we do without you. But finally, that we ask we bring our best selves to work every single day, because our patients deserve it, the communities that we serve deserve it, this great state of New Jersey deserves it. And as we continue on this trajectory and journey of delivering safe, reliable care that is kinder, we will create destination facilities that, beyond just within the state, but the region and indeed the country, will seek us out for care in its best. Thank you so much for all that you do every single day.
Thank you, Alan. I can't say that was very inspirational for us. And I'd like people to really reflect on, as Alan had mentioned, of why we are here. That role of service is so very important. And I loved the pause of that. So it's also a star moment to take that pause before interactions. And of course, we all have a role in how our patients experience any interactions that we have, and it's at all levels. And we'll hear that later also with Chrissy Daniels. We'll be talking about that whole vision, that whole experience of that. So thank you so much, Alan, for bringing us back to our roots and why all of us are here, and that compassion and resilience as as care workers that we have. So thank you for noting all of what we do. So next we have Trina Parks. She's the Executive Vice President and Chief Corporate Officer of the Diversity, Equity, and Inclusion. So many times I hear people say D&I. It's actually Diversity, Equity, and inclusion. Maybe some of that E gets a little blurred. But she has done so much work when you read her bio of bringing DEI strategies to hospitals, local as well as at a system level. And we are so blessed to have Trina on our team, who's been well recognized with a lot of awards. But I think what people need to understand or really value that Trina brings, not only work on race, ethnicity, but the LGBTQ teams, as well as cultural understanding and honoring people's culture of their family and of their maybe religion or of their community is so extremely important. And I love the one part that I hear Trina talk about all the time is an inclusive environment for all. So we'll hear from Trina now. Thank you.
Thanks, Deb. Can you hear me? And can you see my screen?
Yep, we're good.
Okay, perfect. So good afternoon, everyone. It's a pleasure to be here today and an honor to be presenting with such a distinguished panel. Thank you for inviting me in a room to discuss this important policy to formally address and protect our employees as we continue to care for and serve our diverse patient populations. In 2020, after the murder of George Floyd, we needed to heal as a system. Our D&I site leads facilitated courageous conversations to provide a platform where employees could be heard and seen. We believe you cannot fully recover without acknowledgement of the trauma. From the words of Mr. Rogers, who is one of my go-to, if it's mentionable, it's manageable. Employees shared that they were enduring racist remarks, microaggressions, and behaviors from employees, their colleagues, patients, and visitors. Additionally, some patients were refusing care based on the caregiver's race, gender, and ethnicity, and were being reassigned. Under our system's HRO lingo, we stopped the line because as a system, we had to take a stance. We stopped the line because we had to give our leaders and staff a policy to stand on as they communicate with visitors, patients, and each other. We stopped the line because it was long overdue. And we stopped the line to give our employees, especially those of color who experience these behaviors more often than most, what they deserved. During the courageous conversations, we heard a lot regarding clinical interactions from nurses and from physicians as far as, competency. I like one of the nurses at Compassionomics said that her RN actually stands for registered nurse, not real nurse, because of her race. Some people, question if she's a real nurse. We have physicians that will also confronted about, are they competent to serve that patient? Two stories that come to mind for me is that we had an environmental service worker, and that worker was cleaning the patient's room, and the patient threw a water pitcher at her and told her that based on her race, that this will be the only job she will ever have, and basically to clean it up. That employee was afraid to tell anyone. She actually shared it with one of her peers, her colleagues, who reported it to us, and we brought it forward. That employee was more terrified of losing her job than she was about feeling safe while working. Another issue, another circumstance was at one of our hospital lobbies. We had a visitor who was told that he would have to come back for visiting because we had modified COVID-19 visiting hours. So while in the lobby, he of course got upset and started to, call them the N-word, and actually also start to threaten their life, threaten that he would harm them. Due to lack of communication, the visitor was allowed to actually go upstairs in a unit, and the employees were not empowered to stop the line. They actually sent an email to corporate a few days later to share the situation, but we did not deal with that issue in real time. Under the leadership of our soon-to-be retired President and CEO, Barry Ostrowski, a comprehensive multidisciplinary leaders team was developed, including legal, regulatory, quality, patient experience, nursing, our corporate CMO, and corporate CHRO met several times to create a template and kept at it until we finalized the policy. The policy is called the Request for or Refusal by a Patient and RWJBH Workforce Members with Personal Characteristics of Care. This policy describes processes used by RWJBH when there is a request for or refusal of care or other services by a patient because of a personal characteristic of a RWJBH workforce member. A workforce member is defined by anyone engaged in the delivery of healthcare or other services for a patient or visitor, including contractors, volunteers, and students. RWJBH will no longer accommodate discriminatory requests based on personal characteristics related to race, color, age, culture, disability, ethnicity, gender, gender identity or expression, language, military status, religion, or sexual orientation. In limited situations where the patient or an individual on behalf of the patient may ask for an accommodation exemption, accommodation requests only based on gender to protect a patient's religious or cultural beliefs may be considered. When there is an accommodation request, the workforce member who receives such request shall inform their supervisor. The supervisor shall decide whether the accommodation regarding gender should be granted. Additionally, employees may request to withdraw from the patient's care delivery team when faced with imminent danger. Employees' requests must be directed to their supervisor for consideration based on whether the continuity, safety, and quality of care for the patient and other patients will not be compromised. If the workforce member disagrees with the decision, the concern shall be escalated through the appropriate chain of resolution. The policy owner is the Corporate Office of Diversity and Inclusion and was approved by the Dismantling Racism Committee on October in 2020. When executing this policy, RWJBH will ensure that safety is addressed, quality is maintained, respect is imminent, and overall impact of the accommodation of the request is minimized. If the patient, family member, or visitor does not comply with the policy, and once the patient is stabilized for transport in accordance with applicable laws, the healthcare facility may facilitate the patient's transfer to another facility if the accommodation is not withdrawn. From my understanding and to my knowledge, we've had to have many conversations with patients about our policy, but I have never been informed that a patient had been transferred or requested transfer after they were informed of our policy. It is essential that the policy be cascaded down to all of our employees, especially those who are impacted by these circumstances. The policy was communicated through our D&I site leads presenting at leadership meetings. We worked with our corporate CMO and CNOs. It was 2 at that time, CNOs to leadership, to message it and to meet with their leadership teams to discuss and review the policy. We have virtually, we have it on released on System News and Roundup. It's presented in new employee orientation. All employees receive mobile telephone text messages telling them about the policy and access to the policy. It is in most of our patient guidebooks. It's on the bridge on our intranet, and it's also on our diversity and inclusion website. This is a snapshot of the policy that can be accessed from our website in the bridge, as I just stated. Thank you again for the invitation, and our D&I corporate team and site leads will continue to serve as a resource and address race-related issues and inequities in our system. Have a great day.
I love that, Trina. That is great. That little curtain parting, that was very visual. Thank you so much for that. So, you know, we're listening to Trina and talking about what we did to try to help support everyone. And I think the message is for sure supporting of that kindness for all, right? That is for all of us, and that inclusivity for everyone. And remember, I remind you, she said inclusive environment for all. We all need to feel safe. We need to be able to provide the right care for our patients while supporting them, but obviously need to really look at that being safe, right? Safe for all. So really appreciate the work that was done to assure that for our employees, and also that goes down to our staff. Sorry, for our patients and for our community. So very important work that is done with that. So thank you, Trina, for your leadership in that.
Thank you.
Next we have Chrissy Daniels, and she is the Chief Experience Officer at Press Ganey. And as you know, Press Ganey, we've been engaged with Press Ganey not only just for the HCAP survey, but for many other venues as well, other things that we've used them for. But I think what's interesting having her here today, we're so grateful, is she is a national thought leader on patient experience, and also think of healthcare values. That's one of the things she has in her bio here. But when you think about healthcare values, so what is the value to our patients? Has an organization, has Alan brought up, like to be known for us nationally for what we do, doing the right things, being kinder, safer, more reliable. But that comes down to the healthcare value. What is that value for our patients? And that collaborative culture. And we hear that as teamwork. We've heard teamwork come through, but it's about collaboration and culture. So I think we're really going to be wowed in learning about some of the things she's talking about: transparency, consumerisms, and medical practice, how it's all integrated. Again, it's just not about that patient in a bed. It's so much more, as we've heard all of our speakers talk about today. But I really love that one of the things she had mentioned was drive culture change, improving patient experience and value in every encounter across the system. So excited to hear from Chrissy.
Okay.
Thank you.
Thanks, Deb. And I want to lead off by complimenting Trina and the entire organization for leaning into the foundation of patient experience, which is that our caregivers are physically and psychologically and emotionally safe to deliver care. It has been a tumultuous time, and we've seen increasing acts of disrespect. At Press Ganey, we could not be more passionate about the fact that patient experience does not mean that the patient is always right, or that acts of aggression, abuse, or incivility can be tolerated in organizations. And so tremendous compliments to the entire organization for the line, as Trina said, and recognizing a problem and organizing a systemic response to that issue. I couldn't be more thrilled by that. As we wrap up our panel, I'm going to speak to you as a patient, or as a family member, actually. I want to go back to about 1 year ago. I was the oldest daughter. My father, who had been very ill with dementia, had contracted COVID, and he was immediately hospitalized. Within a day or two, the hospital team in his very small town hospital recognized that he would not survive COVID, and it was important to my mother that he come home to die. I was the only vaccinated family member who could help with that, and I was waiting at home to receive him. As he was coming back in the ambulance, we heard a call that there had been a cardiac event with another patient. And little did we know that that cardiac event was my younger sister. She had laid down for a moment and had become responsive. And so as I'm bringing my father home
for his last days, I have to turn to my mother and tell her that her youngest daughter had passed. It was the hardest moment of my life, and I had to rely on Carl, who was our home care nurse and was receiving my stepfather. I said, Carl, can you stay with my stepfather, and my mother and I will go to the hospital. When we got there, I knew, although none of my family knew, that visitation was very restricted in emergency departments. I knew that it was highly likely that we would not be able to go in to see her as they discontinued her life support. We were very fortunate that the team in question had been so thoughtful and situationally aware, and in the moments that they received my sister, they had the foresight to keep her in a trauma bay that would allow us as the family to come in and say goodbye to her. All of that required people, to quote Ellen, who were able to take a pause. What they had to do to meet us in our most difficult times would not be in any guidebook, would not be in any script, would not be any standard operating procedure. These were healthcare professionals who were able to take that pause in the moment and have the support of their organizations and their leaders to exercise judgment to do what was needed in the moment. And that's what I'm going to talk to you about today. How do you create an environment where caregivers have the understanding about what's important to the organization, have the mindfulness to be situationally aware, and have the ability to execute these kinds of decisions in moments that matter most to patients? When we think about patient experience being kinder, gentler, and more reliable, that really is what the patient is looking for us. They know that they're with us in times of stress. The patient experience is very unique. There's really no other experience we have in our lives where we're as vulnerable as humans as we are when we have to seek treatment advice or care or intervention from clinicians. We're very vulnerable. We're often very scared. We're sometimes very difficult. And we can use the principles of high reliability to really shape our own individual thinking, our team thinking, and our processes to be trust building in the most difficult times. Often in high reliability, we're thinking of success as zero harm, the absence of mistakes or errors or incidents. Patient experience is almost the flip side of that. It's not the absence of complaints that delivers true patient experience. It's the presence, the 100% presence of trust building behaviors. You heard an example of two people who exercise those trust building behaviors in a moment. How do you, as leaders of the organization, create an environment where trust building behaviors, the positive, are top of mind? The first challenge would be is don't become preoccupied with complaints. We absolutely have to respond to concerns and complaints. We need to continue to earn the trust of patients even when things don't go well. But understanding what went wrong won't teach our teams how to do it right. So I'm going to encourage you to focus on what it is that your patients love best about you. In fact, you can look in your patient experience data, and we can tell you with statistical certainty what the 3 things are, which if they can happen consistently, are most likely to build trust with your patients in your area of care. In Press Ganey language, we call those the key drivers. Oftentimes, improving patient experience is not about doing more things. It's about doing the right things more often. So my challenge to you in this patient experience week is to go and find a comment or 2 or 3. Look only at your positive comments. Find those comments of the patients you care for who are most delighted. You'll see themes of compassion. You'll see themes of teamwork. One of the most persuasive words I find in a positive comment is when the patient uses the word everyone. It's really easy sometimes to be individually excellent. It's hard to create a team of excellence. So when patients tell us that everyone was wonderful, that's a high art. Look for those comments about how they felt safe. I read a patient comment yesterday where they said they were at peace every minute they were in the hospital. Bring those back to your team and don't simply share them, but study them. Ask your team, be very curious, how did we do this? How could we do it again? And how could we do it every time? I can tell you, having looked at the feedback from your patients, that in most cases, in most settings across RWJBarnabas, between 6 to 8 out of 10 patients are saying they received that trust-building experience every single time. The question isn't what more do we need to do? The question is, why can't we do our best work more often? Engaging our teams and their imaginations, helping them understand that the ideal state is possible and that it matters. Most of the time, we see the biggest opportunity being that individuals don't know of all the things they do, what mattered most. So recognizing excellence, letting people know that those individual behaviors that Alan described really matter to patients. And not only do they matter to patients, they matter to us as leaders and to the organization, is the way that we build the highly reliable delivery of kind, safe, reliable care. I'm thrilled to be your partner in this journey, and it is a journey we are all discovering how we can get better together. My challenge to you is to find the magic that is happening in your organization. Deconstruct what's going right and build systems of reliability so it can happen more often. It's not about fixing ourselves, it's about committing to what's best. We have the luxury at RWJBarnabas to have executives who want us to pause, who value the choice we make every day, and who will commit to supporting tests of change. High reliability gives us the toolkit, whether it's through huddles or safety briefings, 5-to-1 feedback, or even deconstructing root cause of positive interventions. Using our high reliability toolkit to craft the culture where patients can expect 0 harm and 100% trust, that they could say that they felt safe every minute that they were in our care. That's our goal. Thank you so much for including me. I'm honored to be part of this panel.
Excuse me. Thank you, Chrissy. I'm so sorry to hear of your losses, but the story, the message of that at their time of suffering, the impact of that staff's mindfulness, understanding of families' needs is such a strong message that we all need to consider. And I have to say, I am so going to take this, find the magic that is happening, commit to what is best. I can't say any more. You did such a great job on bringing this all together, closing it up for us, and really putting everything that our other speakers have also spoken about, and just wrapping it up in a really great summary for us. And we're so happy and grateful that you were able to come with us today, as well as with our other speakers. I think this has been a truly wonderful way of us to remind ourselves of our values of don't hurt me, heal me, be nice to me, which incorporates psychological safety for all of us, including our employees and our patients and our community. So with that being said, I will just thank everyone for attending. I will also heartfelt thank you to our speakers who provide us with a wide range of thoughts that we need to consider. And I think we are well on our path. This is the culture we talked about, and how we want to continue being that one that provides that wonderful care that we want to provide and experience for all. So with that, I'm going to turn that over to Jill for final thoughts and, I believe, a survey.
Yes, so you should be receiving an email survey. There's just one question. It's the Net Promoter, would you recommend we do this again? So please fill that out, be honest. I believe there's a comment section too. Write those magical comments so we can make improvements when we do this again. Hopefully we'll be able to afford that opportunity by the end of the year to do another panelist discussion like this. So I just want to close it out by saying again, thank you. Thank you so much to Trina, to Alan, to Chrissy. I really appreciate and learned so much from listening to you all. And then of course our curator, Deb. So thank you, Deb, for tying it all together as well. And, you know, I go back to our vision as a, you know, the 15th largest healthcare system in the country, which is creating and sustaining healthy communities together. So, you know, this past hour was just such a great demonstration of that sense of community. I think the highest I saw was close to 155 people that were able to take time out of their schedules and pause and reflect and listen and really participate. So we're just so grateful of that. And it's no accident that the word unity is part of community. So just a wonderful display of that unity, you know, just looking at the different panelists, looking at all the participants. You know, we had staff up and down the leadership pipeline, as well as I noticed some of my Rutgers students on, so kudos to them, some of our vendors, and I'm sure many other folks. So just takes a community to do all this together, and just, again, so grateful for all of you for being here today and participating, and thank you for all you do in every single interaction with our patients, their companions, and with each other. And happy Patient Experience Week again. So thank you.
I guess we should totally take that on the road, right, Deb? That was awesome.
That was awesome. Thank you. It was really
great.
I'm trying to figure out
what a great combination.
Yeah, thank you, Chrissy, for joining. I'm very grateful. It was really good. Good.
Lots to be proud of.
Thank you. All right, I have to figure out how to turn this off. Scott, are you still on? Hold on, I see some other folks. Oh my gosh.
Yes, I am.
How do I turn this off now? I'm afraid to like not do the right thing because I don't want to lose the recording.
Yeah, so you could just hit stop recording.
I don't even see that. Hold on. All right, bye, Chrissy. Thank you so much. I'm trying to see where the stop recording is.
I actually might be able to do it for you.
At least this was like It was at the end. I'm glad that this was the, oh my goodness.
It should be in the same spot where you started it, right below show screen or share screen on the settings tab on the sidebar.
I don't see anything.
Let me see if it lets me do it.
Okay.